So for question 11, so beyond medical treatments, we're just talking about lifestyle. What's lifestyle, wellness, or support factors do you believe can positively impact the fertility journey?
I know for me, acupuncture helped. I had a fibroid, so it was really uncomfortable. And so the acupuncture, I don't know if it was just laying or in all the vascular flow or whatever, all the things they do, but I found that very helpful. I think also putting I think I wasn't hydrating, and I noticed with a lot of patients because lately it's been so hot here, they are very dehydrated. So I think, recognizing nutrition, hydration, taking time for yoga. So like now once a week, I try so hard to get to do that. And then for even for the surrogates, I actually have them, it I'm pretty strict that they walk a lot. So I make them do a log because they don't necessarily have to do like vigorous exercise. It's really just the walking for fresh air and wellness. And then I I like to see who's going to support,
Yeah.
a family, a cousin, or whoever is going to help through the process to be supportive too as well.
Yeah, that's one of our number one things too is the like family support. If they don't have a spouse, like who is it like a family friend or if they don't have at least one person, then that can be a disqualifier, because we don't want them to the surrogate to just go through by herself, right? All right, so let's go to question 12. So, what advice would you give intended parents who may feel uncertain about what path is right for them?
I would write out the pros and cons. So sometimes that sways people when you think are what are the cons with if you've tried many IVF cycles and you feel like why is my body not making a genetically good embryo or what the combination, what can we do? Write out your pros and cons. I think also it seems very helpful to talk to other people, even though sometimes it feels private and your personal sphere of what you're doing. But talking it out opens up things that maybe you weren't aware of. I like the book. It starts with the egg. I read that when I was going to start to try, and I found it made me realize a lot of things that, it helped me through that part. Um, and talking out the fears and yeah, and the health things, we're using a lot of products as women and even guys are too with all these things, and they have phthalates, which perfumes and things like that are not super good for us. So like just trying to be as healthy as you can and recognizing that everybody's path is different. And so that is something I notice. It'll go in these waves where people will say, my friend got so many more eggs. Why did, but comparing ourselves, we're all unique and exposed to different things. So we can't really compare ourselves to other people because it becomes overwhelming.
Yeah. Yeah, everyone's path is different. And I also, like you said, talking it out with people. Like I know sometimes 11, 10 parents can just feel ashamed that they're going through this, but you never should feel that way. And because we talk to 11, 10 parents from across the world, like different cultures and everything, I think it's like very important just to openly talk about it, right? Mhm. All right, so let's see. I think, yeah, so that was the last question, and we'll move into our live Q&A session. So if you guys do have any questions about PMOS, fertility treatments, donor eggs, all that we reviewed just now, you can let us know. We do have a like chat box. Um, and yeah, if you do also, like I said, if you want to talk with us afterwards, if you guys want to talk more personally, me or Dr. Alexander are available. But I'll just give it a sec to see if anyone wants to quickly chat. I also want to ask you, Dr. Alexander, I know before this you were saying that you're involved in like the name switch to PMOS.
Oh
So I just
yeah.
wanted, yeah, a little more detail on like what that was
I
about.
know it was very heated because
Mhm.
it was going to be like a totally different type of name, but I think it's confusing if it wasn't like P. COS,
Right.
kind of like PMOS. So, um, I think for medical endocrinology, it helped to have, switch. They had medical endocrinologists trying to help change the name too, because when it was PCOS, everyone thought it's just the ovary, but really it's your LH to FSH ratio also, which is from your pituitary gland, which is your master control gland, that ratio is a little off kilter to cause lack of ovulation, and as well as the ovaries have theca cell hyperplasia. So the ovary has an appearance of a pearl string of follicles in the perimeter, and that the inside cells called the theca cells make testosterone, or and that can cause, as you know, the hair and the hair loss here, as well as acne, especially during puberty, sometimes early puberty in some young women. And it makes it harder to get pregnant and a higher risk of insulin resistance or impaired glucose tolerance. And so it's like a bit of a cascade. I think one of the things for the M, it was really interesting. They gave like all these choices of what the M should be, and
Mhm.
everybody had to give like a heated discussion on the choices. It was a couple other interesting concepts instead of metabolic. But I liked what we that came up to. It was really, I feel like it fits.
Yeah, and like you said, it's not too like different from what it previously was, so not it's not too confusing.
Yeah.
Yeah,
Funny.
right.
I think a
Okay.
lot of people ask us how long can embryos stay frozen? So
Yeah.
we have a healthy baby from an embryo 20 years ago, and
Mhm.
we're blessed to have an egg that thawed 15 years frozen make a healthy baby, which actually that's one of the
Oh.
pictures of the
Oh.
embryo. So it's kind of a miracle, because I know in some countries they only freeze the eggs for 10 years. So we
Hmm.
found healthy babies from that. Um, yeah, I think that um, to carry your own pregnancy, we go to age 54. So if you're using a donor egg and you realize you want to try, you just have to make sure to talk to maternal fetal medicine and get an EKG and be as healthy as possible before. But you can carry, and then you can use a surrogate till any age you would like, obviously, because the surrogate will be younger.
Yeah. Yeah. I know. Yeah, we get that too when people ask like how long can we have them frozen? I'm like, there's I heard on the news it was like 30 years there was an embryo.
Yeah, they had at Hopkins, we had sperm from 1987.
Whoa.
He was younger and had cancer and froze his sperm, and then didn't use it for, I believe, 32 years. Yeah.
Wow. That's awesome. All right. And then, okay, it looks like we have a question. So someone asked how long should I start eating like or start a healthy lifestyle before starting the IVF journey, and if there's any like supplements that you would recommend.
Oh, yeah, that's a common question. Yeah. So 90 days is the best, but if we're older or the AMH is not as ideal, we
Mhm.
use the month ahead as our target window, especially if we are having hard alcohol or using like having any other toxins and things like that. Retinol's not good for our skin too, because it can absorb. And but the prenatal vitamins with DHA, which is like fish oil, CoQ10 helps the mitochondria energy cells of the egg. And then depending on your vitamin D level, we want to keep it 30 to 50. So if it's like 10, you have to take 50,000 once a week for 5 weeks, then 5,000 a day. If it's in 30 to 50, you would take 2,000 a day. Same with men, because they found vitamin D level between 30 to 50 for men helped improve sperm quality. And then men should be on zinc and fish oil as well, and the CoQ10. If and talk to your doctor too as well. Speak with your doctor on that. And then the month or two or 90 days if you want for acupuncture once a week, avoiding artificial sweeteners and eating more fruits and vegetables.
Awesome. All right. Well, I think, yeah, that's it for now. And thank you again, Dr. Alexander, for joining us
Good
today
to
and
see
sharing.
you.
Yeah, it's good to see you and sharing your expertise and insights. And thank you all who attended today. And we hope that today's discussion helped you understand PMOS, fertility treatment options, and the paths that are available for building a family. So before we wrap up, we have some special offers on the screen. So like I said, we do at ACRC, we have a webinar promotion for individuals exploring IVF. So you can scan the QR code for a complimentary consultation. And if you want to connect with Dr. Alexander, SCRC's team, they're offering 50% off for the initial consultation for the first time consultation. And this is on the screen. And if you're watching the recording right now, you can still always reach out with this QR code and it can be available. So yeah,
Awesome.
yeah. And you can follow us. We have our socials down below. Is there any socials that you
Oh,
want to share,
great.
Dr.
Yeah.
Alexander? Mhm.
Yes, sure. BH Egg Freeze MD is my Instagram.
Perfect. All right.
Okay.
So thank you
Wonderful.
again for joining me today. I really appreciate it. And yeah,
Good.
I hope to see you in the future and we can,
Okay. Yeah, I'd love to. Take
yeah.
care.
All right. Take care.
Bye-bye.
Bye.
Bye-bye.